Good morning, students. Today we will see some of the key reasons in medical surgical nursing. The first one is anemia is common in patients receiving chemotherapy. Chemotherapy can cause damage to the bone marrow. So the bone marrow which is responsible for producing the red blood cells. So this can result in decrease in the number of the red blood cells in the bloodstream that will lead to anemia. And another is certain chemotherapeutic drugs can change or damage the cells in the bone marrow, that is known as myelosuppressive activity, which makes the production of red blood cells will be less. So because of these two reasons, the patients who receive chemotherapy will be prone to develop anemia. The second question, aspirin is given prior to the administration of thrombolytic therapy. Aspirin is a platelet aggregation inhibitor that works by preventing the formation of red blood cells, which help to formation of the blood clots, which can help to improve the blood flow to the affected area. But the other way, thrombolytic therapy is the type of medication that is used to dissolve the blood clots that already formed. So, aspirin can help to prevent the formation of new blood clots while the thrombolytic medication is working to dissolve the existing clots, which can improve the overall effectiveness of the treatment. That is why aspirin is given prior to the administration of thrombolytic therapy. The third question, INR value is monitored in patients after valve replacement. The valve replacement therapy or valve replacement surgery involves the replacement of a damaged or diseased heart valve with a mechanical or biological valve. After the surgery, the patients may require anticoagulant therapy to prevent the formation of the blood clots around the new valve, because the new valve is considered as a foreign organism and there will be chance of developing blood clots. So the patient has to consume the anticoagulant therapy. So this warfarin is the commonest anticoagulant therapy which is used to prevent blood clots in patients with mechanical heart valve. The effectiveness of the warfarin therapy is monitored by measuring the patient's INR value. The INR measures how long it takes for the blood to clot and provides an indication of patient's risk of bleeding or clotting. Monitoring the INR levels is an important part of postoperative care of the patients who have undergone valve replacement surgery and help to ensure the safety and effectiveness of the anticoagulant therapy. Because if the warfarin amount is more, the patient is prone to develop bleed, and the level is less, then it may lead to the formation of the clot. So INR value has to be monitored in the patients who are receiving the valve replacement. Oral hygiene is important in patients receiving radiation therapy for head and neck tumors. Radiation therapy can cause a range of side effects in the oral cavity, including mucositis, that is the inflammation and ulceration of the oral mucosa, xerostomia, that is dry mouth and dental caries. These side effects can be exacerbated by poor oral hygiene, which can lead to the accumulation of plaque and proliferation of bacteria in the oral cavity. Maintaining a good oral hygiene can help to prevent or minimize these side effects and improve the overall quality of life for the patients undergoing radiation therapy. Patients undergoing radiation therapy for head and neck tumors should also receive regular dental checkups and cleaning to help maintain the oral health and identify any issue as early as possible. That is why oral hygiene is very important in patients who are receiving the radiation therapy for head and neck tumors. Next question, monitoring the central venous pressure is important after cardiac surgery. CVP measure the pressure in the right atrium of the heart, and it is an important indicator of fluid status and cardiac function. In cardiac surgery, CVP monitoring typically used to guide the fluid management and assess the adequacy of cardiac output. After cardiac surgery, the patients are often at risk of fluid overload or hypovolemia. Both of can compromise the cardiac function and lead to poor outcome. By monitoring the CVP, the healthcare providers can assess the patient's fluid status and adjust fluid administration as needed to maintain optimal hemodynamic stability. So, CVP monitoring is an important tool for assessing the fluid status for cardiac function in patients after cardiac surgery, and it can help to optimize the patient outcomes and prevent complication. The next question, monitoring chest tube drainage is an important after cardiac surgery. Monitoring the chest tubes is important because it provides important information about patient's fluid status, the effectiveness of the surgical procedure, and presence of any potential complication. Excessive chest tube drainage after cardiac surgery can be a sign of bleeding, while inadequate drainage can indicate presence of a blockage or any other complication. So, monitoring the color, consistency of the fluid draining from the chest tube can also provide important clues about the patient condition. If it is a bright red, it indicates the fresh bleeding from the surgical site, while a change in color of fluid measures presence of an infection. The next question, Valsalva manual should be discouraged in patients with MI. Valsalva manual is a technique involves holding the breath and bearing down, such as during a bowel movement or while lifting heavy weights. This maneuver can result in a temporary increase in the blood pressure followed by a sudden drop in blood pressure and decrease in the cardiac output. In patients with MI, a Valsalva maneuver can be particularly dangerous because it can further compromise the blood flow to the heart muscle, leading to further ischemia or even cardiac arrest. As a result, the healthcare providers typically advise the patients with MI to avoid Valsalva maneuver and other activities that can increase in the thoracic pressure, such as coughing or straining. Next question, 100% of oxygen is administered prior to the suctioning of endotracheal tube. The process of suctioning an endotracheal tube involves inserting catheter into the tube to remove any secretions of mucus that may have accumulated in the airway. This can be uncomfortable for a patient and can also cause brief period of decreased oxygen saturation level. By administering 100% of oxygen prior to the suctioning, the patient's blood oxygen levels can be increased, helping to prevent hypoxemia. Additionally, the oxygen can also loosen any secretions of mucus in the airway, making it easier to suction out. The next question is, people who smoke have 2 to 4 times risk of sudden cardiac death. In fact, the risk of sudden cardiac death is approximately 2 to 4 times higher in people who smoke compared to non-smokers. It is because due to the harmful effects of smoking on cardiovascular system, including damage to the lining of the blood vessels, increased blood pressure, and decreased oxygen supply to the heart. Smoking also increases the risk of other cardiovascular diseases such as coronary artery disease, the major cause of sudden cardiac death. Quitting smoking is one of the most important things as a person can do to reduce the risk of sudden cardiac death and other cardiovascular diseases. The next question, perform passive exercise and flexion of the lower legs to overlay after the open heart surgery. Passive exercise involves moving the joints through a range of motion without using of surrounding muscles, usually with the help of a therapist or a nurse. In case of open heart surgery, the passive exercise of the legs helps to maintain the blood flow and prevent development of deep vein thrombosis. Flexion of the legs also helps to prevent blood clots by promoting blood flow and preventing the stagnation. Thank you for listening.